Welcome to my channel Being Biophilic. In this video, I am going to discuss about a fungal disease, that is histoplasmosis. What is the causative agent of histoplasmosis? Histoplasmosis is an infection caused by the fungus Histoplasma capsulatum. The fungus lives in the environment, particularly in soil that contains large amounts of bird or bat droppings. In the United States, Histoplasma mainly lives in soil in the central and eastern states, especially areas around the Ohio and Mississippi River valleys. The fungus also lives in parts of Central and South America, Africa, Asia and Australia. Transmission of the histoplasmosis. People can get histoplasmosis after breathing in the microscopic fungal spores from the air, often after participating in activities that disturb the soil. Although most people who breathe in the spores don't get sick, those who do may have a fever, cough, and fatigue. Many people who get sick will get better on their own without medication. In some people, such as those who have weakened immune systems, the infection can become severe, especially if it spreads from the lungs to other organs. What are the symptoms of the disease? Symptoms of histoplasmosis include fever, cough, fatigue, extreme tiredness, chills, headache, chest pain, body aches. Symptoms of histoplasmosis may appear between 3 and 17 days after a person breathes in the fungal spores. For most people, the symptoms of histoplasmosis will go away within a few weeks to a month. However, some people have symptoms that last longer than this, especially if the infection becomes severe. In some people, usually those who have weakened immune systems, histoplasmosis can develop into a long-term lung infection, or it can spread from the lungs to other parts of the body, such as the central nervous system, the brain and spinal cord. Life cycle of histoplasma. Histoplasma capsulatum grows as a saprophytic mold in the soil. It is a thermally dimorphic fungus. It grows as a mold in mycelial form at normal temperatures and convert to yeast form at 37 degrees Celsius. The mycelial form with small and large vegetative spores, micro and macroconidia, respectively, is depicted in this image. Histoplasma spores become airborne when contaminated soil is disturbed. The spores are so tiny that they are invisible to the naked eye. Once inside the lungs, the spores transform into yeast due to the body's temperature. The yeast can then spread to lymph nodes and other parts of the body through the bloodstream. Risk of histoplasmosis. Anyone can get histoplasmosis if they've been in an area where histoplasma lives in the environment. Histoplasmosis is often associated with activities that disturb soil, particularly soil that contains bird or bat droppings. Certain groups of people are at higher risk for developing the severe forms of histoplasmosis. People who have weakened immune systems, for example, people who have HIV, AIDS, have had an organ transplant, are taking medications such as corticosteroids or TNF inhibitors, infants, adults aged 55 and older. Contagiousness of histoplasmosis. Histoplasmosis is not contagious between people or between people and animals. However, extremely rare cases have shown that the infection can be transmitted through an organ transplant involving an infected organ. Diagnosis of histoplasmosis. Healthcare providers typically diagnose histoplasmosis using blood or urine tests, along with medical and travel history, physical examinations, and laboratory tests. Some imaging tests like chest X-rays or CT scans, respiratory tract fluid analysis, and tissue biopsies are also performed. Prevention of histoplasmosis. Avoiding exposure to histoplasma in regions where it is prevalent can be challenging. Individuals with weakened immune systems should avoid activities associated with histoplasmosis, such as disturbing soil with bird or bat droppings, cleaning chicken coops, exploring caves, and renovating or demolishing old buildings. Large amounts of bird or bat droppings should be cleaned up by professional hazardous waste removal companies. Treatment of histoplasmosis. While some cases of histoplasmosis resolve without treatment, severe lung infections, chronic histoplasmosis, and disseminated infections require prescription antifungal medication. Itraconazole is a commonly used antifungal medication for treating histoplasmosis. The duration of treatment varies depending on the infection's severity and the individual's immune status, ranging from 3 months to 1 year. This is all about histoplasmosis. If you have any questions, write it in the comments. Thanks for watching.